Antibiotics, they can be real miracle drugs, can't they?
Absolutely life-saving in many cases.
But what if one that was used really widely for decades, turned out to have this this really profound cost?
Yeah.
We're talking disabling long-term effects that just completely change people's lives.
And that's exactly the paradox we're diving into today. We're looking at a class of antibiotics called fluoroquinolones.
Right.
For years, they were really highly valued, great for lots of bacterial infections. People even said they had an excellent safety record.
That's what's so striking. Because we've dug into, quite a stack of sources, articles, research, official warnings, and they tell a very, very different story. So our mission for you today is to really unpack the severe, often disabling, sometimes irreversible side effects linked to these drugs.
Yeah, get ready for some pretty surprising facts here.
Okay, let's unpack this. So many of you listening might have heard of these, maybe even taken them. Drugs like ciprofloxacin or Levaquin, levofloxacin.
Very likely. They were prescribed for all sorts, UTIs, pneumonia, really common stuff.
But what's amazing, truly, is seeing how the official advice, the clinical guidance, has shifted.
Oh, definitely. It's a huge shift. Because of all these mounting concerns, regulatory bodies like the FDA now strongly advise against just routinely using them for mild things.
Like what kind of mild things?
Well, like uncomplicated UTIs, or maybe acute sinusitis, acute bronchitis. The kind of things where there are usually other safer options.
So they're reserved now?
Pretty much. Reserved for, severe infections where maybe other antibiotics haven't worked or can't be used. It's a critical change.
Okay, so here's where it gets really, really interesting for me. Our sources talk about something called fluoroquinolone-associated disability, FQAD.
FQAD, right.
This isn't just like a standard side effect, is it? It sounds much more serious.
It absolutely is.
Right.
FQAD is defined as a severe multisystemic condition. That means the symptoms hit at least two different body systems.
Two systems, okay.
Like tendons and nerves, for example. And crucially, these symptoms have to last for 30 days or more after you stop taking the drug.
30 days or longer.
Or longer. And that's the really alarming part. Many patients report these effects going on for months, sometimes even years.
Years. Wow.
We've seen accounts, descriptions of symptoms sticking around for as long as 9 years.
9 years? That's staggering. And it's not just one type of problem. You said multiple systems.
Exactly. The range is just incredible. You're talking severe tendon problems, tendinopathy, even tendon ruptures.
Ruptures, like snap.
Yeah. The Achilles tendon is the most common one, and it can happen fast, maybe within 48 hours of starting the drug.
Or later, you mentioned.
Or, sometimes months after you finish the medication. It's not always immediate.
Okay.
Then there's peripheral neuropathy, nerve damage in the arms and legs, which can be irreversible.
Irreversible nerve damage.
Yes. And big effects on the central nervous system, too. Things like confusion, seizures, even psychosis.
Psychosis from an antibiotic.
It's documented. And even suicidal thoughts. And these CNS effects can come on really quickly, sometimes after just one single dose.
Just one pill.
It's possible. And it doesn't stop there. The heart can be affected, risks of life-threatening arrhythmias.
Okay, this is serious.
And really critical warnings about an increased risk of aortic dissection or aneurysm.
That's the main artery in the body, right? A tear in it.
Exactly. A tear or a bulge in the body's largest artery. Life-threatening stuff. Plus, severe blood sugar problems, like dangerous hypoglycemia.
Wow. It's such a broad range of really severe potential harms. Is there like a common thread? What's the mechanism connecting all these different issues?
That's the key question, right? And the research points to a couple of core mechanisms. One is damage to mitochondria.
The powerhouses of the cells.
Exactly. If you damage those, you can get widespread dysfunction across many tissues. The other big one is disruption of collagen.
Collagen, okay. Like in skin and joints.
Precisely. It's the main structural protein in tendons, but also in blood vessels, cartilage. So that disruption helps explain the tendon ruptures and the aortic issues as well.
That makes sense. But if it's causing all these problems, why isn't it recognized more often? You hear about these effects, but...
That's a huge challenge. Because the symptoms are often so widespread, maybe kind of non-specific, they often get misdiagnosed.
As what?
Things like fibromyalgia, chronic fatigue syndrome, sometimes even mistaken for early Parkinson's disease.
Really?
Yeah. And adding to that problem is massive underreporting. The estimates are just shocking, suggesting maybe 90 to 99% of adverse events never actually get reported to regulatory agencies.
90 to 99%. That's unbelievable. It means what we know is just the tip of the iceberg.
Pretty much.
Yeah.
It likely explains why regulatory bodies like the FDA have had to issue multiple boxed warnings.
That's their most serious warning level, right?
It is their highest level of caution. And they've issued them specifically for the tendon ruptures, the peripheral neuropathy.
And the other things.
Yes, also covering risks like the blood sugar disturbances, the mental health effects, and those critical aortic events. It really shows there's a global consensus now about how serious these harms can be.
Okay, so wrapping this up, what's the main takeaway for you, the listener?
Well, it clearly means that a very cautious approach to these specific potent antibiotics is absolutely essential.
Right. Use them only when really necessary.
Exactly. And it raises a bigger question too, doesn't it? When we rely on powerful medicines, how vigilant do we really need to be, even years after we've taken them?
That idea that a drug you took maybe weeks, months, or years ago could start a chain reaction of damage, potentially irreversible damage, long after it's supposedly gone from your system.
It's a profound thought.
It really is. It's a reminder, I think, to always be aware of the full range of potential effects and definitely talk to your doctor about all your symptoms.
Absolutely. No matter how unrelated they might seem to a medication you took in the past, you just never know. So thinking about all this, what stands out most to you